Our very first segment, which is a very important one. In the next month, when millions of kids are headed back to school, they'll most likely be met with new friends and influences. But parents and grandparents should be talking about the dangers of prescription drugs now. Doctors Ronald and Cherie Santasiero have been treating addicted kids in Western New York for years and know all too well what can happen when a teen is introduced to prescription opioids. They've written a book that we have right here. The book is called Addicted Kids, Our Lost Generation, an integrative approach to understanding and treating addicted teens. And they are both here this morning to talk about this problem. So good morning, folks, and thank you for coming in.
Thank you for having us.
Well, you're so welcome. And when we talk about opiate drugs, what drugs are we talking about, and how do the kids, what do the kids call these drugs?
The opiates that we're seeing mostly are hydrocodone, which is known as Lortab, Vicodin, and then they go into something called OxyContin, which is a big drug that's diverted onto the streets, and then fentanyl, which we're hearing a lot about. Yeah. Fentanyl is an extremely dangerous drug. 1 kilogram of fentanyl is enough to make 10 million doses.
Oh my goodness.
And then they finally go on to heroin, which is the big problem in the high schools and the young teens.
Now, a lot of parents and grandparents would say, but this is prescribed for me, whether they're having pain or whatever. It's a legal drug for them. How does this make them feel? Why are kids taking this?
Well, the thing we wanted to talk about in the book is that addiction is a disease. It is not a moral problem. It is not children that are, morally depleted or they have other issues. And when they take the opiate at first, they feel normal because it actually calms them down. Many of them have anxiety issues. And then if they have the right biochemistry, which is about 4 in 100 people do, they will get addicted to the drug, and then they will build tolerance, which means they need more of the drug to get the same effect, and ultimately they end up within 3 or 4 years on heroin.
Oh my goodness.
But I will also say that a good number of them get the drugs from properly prescribed prescriptions from a family member. One of the things the addicted kids do is they go into the first thing they do when they come to your house is I have to go to the bathroom, go into the medicine cabinet, and you notice a few pills are missing, and then they keep coming back, and ultimately the prescription is gone.
Now, we have had kids get addicted to these drugs where they themselves have been prescribed this.
Correct. I would say
a lot, yeah. 15
to 20% of the addiction we see is for an injury. They injure themselves in an accident, and they don't know they have that biochemical issue, and then they ultimately get addicted.
So the doctor's thinking, okay, you've had X amount of these pills, you don't need this anymore, and the child is asking you to refill this.
Correct. The other problem is let's say you go to the dentist to have a tooth pulled. Number one, you don't need an opiate most of the time. Number two, you don't need 60 of them. You might only need a day or two. So what happens to the other drugs? They get put in the medicine cabinet, and then ultimately someone comes and gets into them.
So Cherie, what we're looking to do now before school starts is have parents and grandparents talk to their kids about the dangers of these drugs now, because again, some of these kids will be exposed to this for the first time when they go back. New friends, new experiences, new influences.
Absolutely, and I'd like to see people, when they ask me, when should I start talking to my child about drugs? Oh, about 4 or 5. Nothing complicated, black and white. Drugs are bad. Never take drugs from anybody, just a doctor if mommy says so or daddy said so. That's all you have to say. Drugs could kill you. Do they understand exactly what you're saying? Not on a conscious level, but you're instilling fear of drugs. My parents did it to me. Never take a cigarette from a stranger. It could be marijuana.
Yeah.
Doesn't look anything like marijuana, but it made me afraid of drugs. And they told me addiction runs in the family.
Yeah.
You could become addicted. So keep it simple for little kids, but don't wait. If you wait till they're 12 years old, they're already listening to their other friends who are fooling around with drugs.
Oh, wow, 12. That's so scary.
It is.
Doctor, maybe you could talk about some signs where your kids may already have been experimenting with this or already in trouble.
Well, interestingly, when we see an addicted kid who is on heroin at age 16, they started at age 9 or 10 with alcohol. So the usual progression is age 9 or 10 alcohol, then they get into marijuana, then they might experiment with cocaine, but most opiate addicts don't like cocaine. It makes them too excited. So then they get into the hydrocodone at age 13, 14. But some of the signs are they all of a sudden have all new friends. their grades start to go south, and they start to sleep all the time. They don't want to be involved in anything with the family. And trouble at school, you know, normally a kid that's a good student, you get a call that your child's falling asleep in class. Parents will find drug paraphernalia, and sometimes they'll deny it, sometimes they just pretend it's not there. So basically, as a parent, your child's not acting normal. And we always suggest, if that's true, you need to drug test your child or get them to someone who can deal with this.
So are there behaviors before this happens that can lead to addiction? And what age are we looking at?
Well, as Cherie said, some of the things we think are innocuous can actually be detrimental, like, you know, allowing your kids to serve drinks or allowing them to light your cigarette. And probably the absolute worst thing we see parents do is say, I'm going to have, when they're 15, 16, I'm going to have my child smoke his first joint with me to show him that it's safe, not knowing that that child is now you're condoning it, and also you're also setting the stage for an addiction problem later. If there's a history of addiction or mental health problems in the family, that's also a warning sign.
Wow, that's so scary to me. I mean, obviously you're professionals, you've heard this from patients. I'm going to let my child smoke their first joint with me. Like, that just blows me away. That you'd actually have somebody say that to you.
Yeah. As if they're only going to do it with mom and dad.
Exactly.
After, yeah.
So what do we do for the parents and grandparents who are nodding out there going, uh-oh, I think I've got a child in trouble already? What do we do?
Well, first of all, if they're in trouble, get professional help, because one of the things we try to emphasize in the book, this is a disease. This is not a moral problem. And I think we've made a big mistake having a war on drugs. There should be a war on addiction, because 80% of the people in prison are either drug-related or addicted. Also, we have a problem in the United States which stems from our culture, in that we have 4.5% of the population but use 80% of the prescribed opiates. And because of technology, drugs like fentanyl, which are extremely potent, have a much higher addiction potential. So if 4 out of 100 are going to get addicted with hydrocodone, it might be as high as 20 or 30 out of 100 if they're using heroin. So the other big mistake is parents thinking it can't be my child. But we've seen children from every type of socioeconomic background, and if your child has that biochemical abnormality, they are prone to it. So just be aware that nobody is immune to this.
You know, Cherie, as I'm hearing Ron talk, I'm thinking to myself, you know what, a nosy parent is a good parent.
Absolutely.
Absolutely.
You know what I mean? You can just sense where there are some people who want to say, almost ignore it and say, no, that can't be my child. It's like, if I ignore it, maybe this will go away. Well, an addiction doesn't go away.
No, it does not.
And you have to be that kind of parent who wants to know who your kids are associating with and what's going on and what kind of behaviors are they exhibiting and how they're doing in school, and being you know, that kind of a parent.
Well, what's
so
your
you
bottom
know when
line?
there's changes in their behavior.
Is this about your child or about you?
Right.
I don't want my kid to hate me.
Yes, yes.
You know how many kids say I hate you?
Right, right.
I did it.
Guess what? They're supposed to at that age.
You know, what they mean is I'm mad, I'm angry, you know, but that's our job as parents, not to win popularity contests.
Right.
They'll respect you more later as adults, or if and when they have children.
If they don't like you at a certain age, then you're doing your job.
Exactly.
That's basically because you're the gatekeeper.
That's right.
As the parent. You take that on as they're born.
A lot of enabling parents, and there's a difference between being supportive and not being enabling. You know, not allowing or perpetuating. You know, we both have had patients, parents say, well, should I still pay for her cell phone? That's how she's making drug deals. No, she doesn't need a cell phone.
It sounds like you need to counsel the parents just as much as we talk to the addicted child.
Absolutely, but it's very difficult to get them in.
Really?
Yes, it is.
That's a little scary.
It is.
But boy, you've raised some really good questions and some good points, and we want to let everybody know that the Santaserios have an incredible book, and if you'd like to get this and learn more about it, as they said, first of all, if you recognize your child and what we're talking about, get them some help and get it today. This book is available through addictedkids.net. That's addictedkids.net, and they'll be able to let you know where to get this. This was just great information. Hopefully you can come back and we can talk about this again.
Yeah, I'd love to.
Absolutely.
Because it's a bigger problem than people know.
Thank you for having us.
Okay, we'll take a break and be right back.